The question from Westside Grand Rapids resident Susan Miller is one we get many times a day at News 8. Quote, why are we still under a lockdown when the hospitals are not overflowing? In fact, not only are they not overflowing, they're empty and laying off employees. Here's one reason why. Governor Gretchen Whitmer's executive order eliminating elective procedures at hospitals in order to make room for potential COVID patients and to reduce the possibility of contact.
Those elective procedures are really the bread and butter of most hospitals, most health systems, most practitioners in our state.
Marianne Udall Phillips is executive director for the Center for Health Research Transformation, which helps translate factual scientific information and studies for policymakers and the public.
Even though we've had a spike, especially in some communities, in coronavirus cases in hospitals, they're not nearly enough to replace all those elective procedures that were occurring before this.
All outpatient procedures and most in-office visits are being replaced by televisits, and that may be something that sticks beyond the height of the pandemic. People are also allegedly nervous about going to the hospital, even for things like childbirth. Emergency room numbers are way down because people are avoiding hospitals and also because fewer people are driving. In terms of reductions, the biggest news comes out of the Detroit area, where Beaumont Health laid off 2,485 employees and permanently eliminated 450 jobs, and Henry Ford temporarily laid off 2,800 employees. Bronson Hospital in Kalamazoo claims a 50% revenue loss and is planning hundreds of temporary layoffs. Spectrum Health in Grand Rapids has not announced layoffs, but executives are taking pay cuts, including a 40% pay reduction for CEO Tina Fries-Decker. Trinity Health System, which owns St. Mary's in Grand Rapids and the Hackley campus in Muskegon, announced it will lay off 10% of its staff. U of M in Wyoming has made no public announcement of cuts, but it's unlikely any hospital system will remain unscathed.
So every hospital, everywhere in the country, is struggling right now.
One thing that is clear, hospitals are not struggling because the coronavirus is somehow failing to live up to the hype.
We have no data to say the virus is not as serious as we thought it was. In fact, all of the data that's coming in is saying to us that the virus is very serious.
In Wyoming, Barton Dieters, News 8.